Hi everyone, welcome to the Intersection of Motherhood and Entrepreneurship series. My name is Dr. Amy Abelar, and in this video we are going to talk about a few different options for preparing for maternity leave, specifically discussing whether you have another acupuncturist cover for your patients or not. I had 2 different maternity leaves and I did it 2 different ways. So my very first maternity leave, I didn't have a huge practice at that point. I did, however, still have the massage side of the business. So I had a lot of massage therapists, receptionists, an office manager, all of those things. But specific to acupuncture, I did not have another acupuncturist that was working for me, and I was really only working part-time. I didn't have a long history of acupuncture practice prior to when I knew I was going to be starting to try for my first baby. And so I kind of went into practice knowing that I was going to be preparing for taking a maternity leave. So I didn't really want to ramp up my practice in some huge way just to then leave patients without an acupuncturist during my maternity leave. And the reason why I say that is because when I was trying to make that decision, I knew that it was going to be a ton of work to just prepare the rest of the entire business for me being on maternity leave, which is something we'll talk about later. I also knew that it was going to take a ton of effort to ramp the business up just to hire another acupuncturist. And I really didn't want my first time of hiring another acupuncturist to be this unknown experience, right? As it being a first thing for me. I didn't really want to do that while also being on my very first maternity leave, because that just seemed like a lot of stress and a lot of unknowns and a lot of chaos that I didn't need. So what I decided to do was focus more on the massage side of the business, get everything squared away with that so that it would be easier for me to take maternity leave. And then I reached out to 3 different acupuncturists in the area that I knew and I trusted. And I said, hey, I'm going to be, once I was pregnant and going through my pregnancy, getting further along, I reached out to them and said, hey, I'm going to be taking a maternity leave for roughly this time frame. Would you be okay if I put you on a list of a recommendation for where I could send patients? And I had somebody that I knew was really good at orthopedics on the list. I had somebody that I knew was really good at fertility. And then I had another acupuncturist as well that kind of did a lot of general things. And so they all said, absolutely, we would love to treat your patients for you while you're on leave. And I let them know that if needed, I could just send over the initial treatment forms and HIPAA compliant, of course, but I could send over the forms for treatment notes and charting that I already had for some of these patients if those patients did end up coming to see them, so that ideally those patients could just continue on with a follow-up. And some of these acupuncturists said, that's no problem. We will go based off of what you have had in your notes already and look at their health form, and then we can treat them with a follow-up instead of them having to kind of start over an entire process with another acupuncturist. So that's how I did it my very first time. I did have a specific job that I did off-site, which was for a drug and rehab center. And I would go every 2 weeks and do not a protocol for the treatment center as a group. There was 2 different locations I went to. And so I did have somebody, because I was going to be out for a little while. And as I was getting further along in my pregnancy, it was getting pretty challenging to kind of lean over at an angle and needle patients to the side while they're all sitting in chairs. That was getting harder on my body towards the end of pregnancy. So I asked one of the acupuncturists if he would be comfortable going and doing these treatments for me, and he agreed to do that. So I got him onboarded with them and got him all squared away so that he went every other week and did that for me through the last bit of my pregnancy, and then also through the maternity leave that I took, and then kind of continued on with it for a little while because I didn't really have enough childcare coverage to go back and also take on that job, as well as my follow-up patients. So he took that for me for a little while, which I really appreciated, and it was really nice. So if you do have a gig like that where you have committed that you're going to go and you're going to do something every other week or whatever the frequency is, I would recommend trying to find a replacement, whether it's full, a ongoing replacement that's just like fully replaces you and you don't ever take the job back, or ideally someone who can step in and do that gig for you, that you can trust to do that gig for you and then pass it back to you when you're ready to take it back on. So that was one of the ways that I did it was for excuse me, for my first pregnancy. The way that I did it for my second pregnancy was different. My second pregnancy, I had already grown my acupuncture practice to be big enough that I definitely wanted to have another acupuncturist that was going to take over my patients and be in the office for while I was on my maternity leave, and then continue on after that. So when you're trying to decide, should you hire another acupuncturist for your maternity leave or not, you kind of want to look at, am I at that point where I'm ready to expand anyways, where I would want to have another acupuncturist continue to be on my staffing anyways. So ideally, depending on how your schedule is as you're growing, you want to find someone who is comfortable with starting part-time, or maybe somebody who just wants to stay part-time. And that way they're there and available for your patients while you're gone. Obviously, there's going to be some patients who will just wait to see you. There's going to be a lot of other patients who will want to come in and see the other acupuncturist. The other thing that makes it really nice about having another acupuncturist, and I hired her, I think in like a May, and my baby was due in November. So we had quite a bit of time for her to kind of get in the groove of things, us to work out whatever we needed to work out with her training and making sure that we were on the same page with things. She also then took over the offsite drug rehab center job for me. My pregnancy the second time around was much harder on my body. So she took over those locations for me earlier on. So that was very helpful to have her to do that. And then also now I'm keeping that within the business instead of referring it out. So that was great. And then she also was there a couple of days a week. And so if I had a really hard time, or I was, having bad morning sickness, needed the day off, there was somebody else to help cover those patients. The other thing that was really nice about it is she was also able to take on new patients. So one of the challenges is as you're getting closer towards taking maternity leave, you're going to have a hard time where, let's say somebody is coming in to get established with you, but you're towards the very end and you hardly have any time in your schedule anyways, because you've cut your schedule back, you're only seeing follow-up patients. That's what I recommend, cutting your schedule back a little bit so your body can handle it, if that's what you need. And then also having somebody else who can take on new patients so that you're not taking on new patients and then leaving for maternity leave. During my first pregnancy, when I knew that I was not going to be there for, a while, I took a few weeks off before the baby was born. And then I think it was eight weeks after, is what I took the first time. And so I knew that for that chunk of time, I wasn't going to be available. And I really didn't want to tell somebody at their initial appointment, hey, I'm leaving for maternity leave in like 3 weeks or 2 weeks or whatever the case was. So that was another thing that I did, was prior to my first maternity leave, I let people know, hey, I'd have the receptionist reach out and say, Amy's going to be going on maternity leave in approximately 3 weeks. So if you do have something where you really want to get in and it's, a pain related thing where we can get you some help within the next couple of weeks, you are welcome to stay on the schedule. However, if it's something like a fertility patient or something that's going to need a little more long-term care, and you're looking to like really get established, then we might not be the practice for you right now, because she's going to be going on maternity leave and she's not going to be able to be here for a little while. And we don't have another person who's filling in, but here's the list of people that we are going to recommend for while Amy is gone. So that was kind of how we handled it initially, because again, is it good for me to make more money before I go on maternity leave? Of course, but from the best interest of the patient, which is always my perspective, the best interest of the patient is, there were a lot of people who, we had both. We had some people who said, I'm super desperate, I'm in pain, I just need to get in now. I'll take, whatever she has over the next couple of weeks. Perfect, no problem, I accommodated. But we also had people who said, no, I really appreciate that, I am looking for some longer term care. And then they called one of the people we recommended. So that worked out really well. And patients appreciate that, right? Because you're thinking about them. So the other thing that I want to talk about is, for the second time around with me having another acupuncturist. I changed my online scheduling and let the receptionist know not to schedule me with any new patients for that last little bit of my maternity leave. And you decide how long that is for you. Unfortunately, I had a very rough second pregnancy, and I thought I was maybe even going to need to go on maternity leave at like 30 weeks. Thankfully, I did not, but I really had to cut back. So for quite a long time, I did not take any new acupuncture patients unless it was somebody who specifically requested me because one of my other patients that was also seeing me had recommended me, and that was pretty much the only exception. Other than that, I did not take any new clients, and all of those new clients went to our other acupuncturist. So that really helped, having another acupuncturist who people could get started with, and some of those people still see her today, right? So there's a couple different ways you can do it. There's also an option where you can have somebody who fills in for you. So let's say I wanted to take a middle ground, and I didn't want to refer everybody out, but I also didn't want to have somebody that I was going to hire as an ongoing thing. You also could have somebody that you bring in to work on your patients for a short period of time. You say, hey, would you come and, I could have asked one of the other providers, would you be willing to add 1 day a week at my clinic and see patients here? That way I have somebody who, they don't have to go off-site, but they can be here, and we'll get you added into the system so you've got access to their treatment notes and all of that. Could we hire you short term for the time frame that I'm going to be on maternity leave to add a day or two a week, right? So you can go that route as well. But there's a few different ways to approach it. It depends on what your goals are. It depends on where you're at in your practice, if you're going to want to hire another person or not. And then the other thing that I do want to make sure that I cover is I want to make sure that I just touch on, if you are a solo acupuncturist and you have no receptionist, no other employees, then obviously you can have something that says, on my website, I have a list, your voicemail recording, basically, like you're out, you're on maternity leave, you're not there, there's no receptionist there to answer your phones. And so you can just change your voicemail to say, I'm out on maternity leave until such and such time, or I'm out of the office until such and such time. If you are looking for an acupuncture appointment before then, here are a few different businesses that I recommend. And I will not be checking voicemail during, this time period. That way you don't end up with like a crazy full voicemail box. So that could be a way that you handle new patients calling in during that time frame. If you do have a receptionist where it's just you, you're gonna have to figure out what you want to have them do while you're gone on maternity leave, right? Because if you take off a couple of months, you're not necessarily gonna want to pay for a receptionist to be there for those months. But you're also not really gonna want to let them go if you know them and you like them. So, that's something that will have to be navigated as well. But if you're on the other side of that, where you have an acupuncturist, but you also have other providers that are working for you, just know, if you are the boss, there is no such thing as 100% off of maternity leave, right? There will be things that you will have to answer. There will be things that you will have to handle, unfortunately, during that time off. I can tell you a horrible example, or I should say an example of something horrible, is I actually, when I was like 36 weeks pregnant, I think, I had a receptionist who quit on the spot, like quit no notice that morning. And I found out she was quitting like 10 minutes before her shift was supposed to start. And so I ended up, I was in the shower, I get out of the shower, I see her text that she's quitting and she's not coming back. And so I ended up having wet hair, no makeup, race, throw some clothes on, race to the office, get the front door unlocked. And that way massage therapists could be there to get their clients ready, or get the rooms ready for their clients, have clients get started. And, so I mean, stuff happens, right? You're going to have to figure out how to deal with that. I was very lucky that that happened not while I had a newborn at home and right before, and I was able to put something in place before I did take my maternity leave. But, when you're the boss, everything will end up falling back on you unless you have somebody, excuse me, unless you have somebody who is very delegated, that is supposed to be handling all of that in your place. And then also if you have systems in place. So this is one of the things that I talk about and coach and teach and provide documentation for in acupuncture practice systems is how to get all of that established, how to set up your business for success and your practice for success with systems so that you are less needed. And because that doesn't just apply for maternity leave, it applies for all of the time, right? You don't want to be out to dinner with your family or at your kid's soccer game and your phone's getting blown up because your receptionists don't know how to handle certain situations, or, other providers have questions. They don't know how to handle certain patient types, or what should they say because this patient came in with this. And so creating systems is one of the best ways to get your piece, but there's never going to be such a thing, at least in my experience so far, to be 100% off, right? So working on delegating things as much as you can is huge. Having the documentation all lined up and systems all lined up so that you have to be bothered less while you're on that time. All of that is great. You want to try to get all of that in place as much as possible. And through acupuncture practice systems, if that's something you're interested in, we can definitely help with that. The other thing that you want to keep in mind when you're on maternity leave is to just enjoy it, right? You're trying to plan and prepare for a time that is going to be a wonderful but also very tired time in your life. And you want to be able to just be in that space and be with your baby and be at home and be navigating all of that, especially if it's your first maternity leave, because all of those moments are just this wonderful, crazy time, and you want to be able to be very present for that. So whether you're trying to decide, do I want to hire another person or not, one of the most important things is going to be that you figure out the best way to either to explore, do I want the stress of hiring another person before I leave or not? Obviously, if you don't hire another acupuncturist, then you have no acupuncture income that's coming in during that time, unless you are on private or state disability, which we'll talk about in another video. We'll talk about how to financially set yourself up for that, for maternity leave in another video. But, so for this purpose, obviously, if you don't have another person in place, it's less money in the door while you are on maternity leave. If you do have somebody in place, you're making money off of them doing the services while you're gone. So there is that. But again, it's more stress to have somebody else there than it is to just say, you know what, I'm out of office. I'm not there. I'll return on this date. And if you can afford to do that, that is definitely a lower stress way to go. So lots of different options for what you can do. And again, so this video basically being, should I hire another provider? Should I not hire another provider? And just talking about what some of those different options look like. That's the topic for this video. We've got plenty of other videos in this series, and I will see you in the next one.